increased recognition now that the social model of health can actually reduce the pressure on the NHS services. So Spring acts as a link between the health service and the community, and it's a way for medical care to be linked to non-clinical, locally delivered, community-based support services. So it enables medical professionals like GPs or pharmacists or mental health workers to refer people, and that social prescriber then works with the individual to support them to access a range of activities, services. So Spring works with individuals to identify the different factors which are affecting their health and well-being and identifies ways to improve these. So this could be through attending a local gym or a craft class or accessing counselling for the first time. Whatever it is, it's unique and individual to the person who's being supported. The Spring Social Prescribing project is the largest of its kind. So it's formed through a partnership between the Bogside and Brandywell Health Forum, the Healthy Living Centre Alliance and Scottish Communities for Health and Wellbeing.
Hi, I'm Rachel. I'm the Spring Social Prescriber for Health and Mind in the Scottish Borders. The way that looks for the client in the Scottish Borders is we accept referrals through health professionals, so GP practices, community mental health teams. Anyone can go to their GP and request to be referred to this service. There's always a sort of penny drops moment where it's like, I can do this. This isn't as hard as I thought it was going to be, and it's just that it's kind of that moment where they've overcome their barrier. I think when you can kind of hear that in their voice or witness them doing that, that's a really big part of the work. What we try to encourage people to look at is a learning experience rather than a failure. And we do often say to people, focus on what you can do, not what you can't do. So if you can't get to the end of the gate, well, can you get halfway? Does that feel more achievable for you? And that's the approach we try to adopt. Well, I remember speaking to you when I first called you, and I remember me talking about the service and saying about how we help you to make wee changes, and we talked about maybe finding you a Scrabble club or just getting you more connected with other people, and I remember you just turning around and going, yes please.
Oh yes please, for Scrabble. Oh dear, if I didn't have my Scrabble on here, I'd be totally lost now. Gave me something to look forward to every week. When I was a youngster, I was very confident, but I had 9 years being an abused wife, and that knocked every bit of confidence, every bit of self-esteem that I had, every solitary bit. I was left with none at all, and it just never came back. I couldn't just going out say I needed to be headed somewhere. I got more confident to go out with you. I started doing my own shopping.
You're getting out the house on your scooter by yourself?
Give me an incentive.
Rachel contacted me, and when they explained the service that you offer, I thought it would be actually quite useful for me. Basically, they don't look at you as a patient. When you're talking to somebody, they haven't got your mental health records in front of them. They'd find ways to facilitate me getting involved in the community, things like the gym. I'm sort of quite goal orientated. So just have somebody say to me, you've got to go out and walk for 5 minutes. I'll go out and walk for 5 minutes, even if I don't feel like it. So in that respect, it was just somebody to help me sort of target those things, and eventually, getting back into living outside the little bubble I've created. Prior to the COVID thing, I was trying to, like I said, break that bubble and start being more proactive rather than reactive.
It was interesting having a face-to-face but sort of semi-informal and in sort of mental health support in my spaces, as opposed to in dedicated spaces sort of set aside like traditional counselling or therapy. It's been good. It's been a good service.
We really want to highlight within Spring that it's not just for now, it's something that we really see as being something that can continue forward, and this can be a legacy for the way that we support people in the future with their health and well-being.
I can say what I think would help me rather than them telling me what would help me. A target's got to be achievable, basically. And that's something that Rachel said to me.
whether you're in a remote island in the north of Scotland or whether you're in Edinburgh, that approach is taken no matter where you are, and that the benefit of community support is there.